Have you ever thought, I just need one provider to give me a chance to do their medical billing? It could be any provider. I just need a provider. Well, let me tell you, that approach can lead to lots of stress and maybe even unhappy clients. Not every provider is a perfect match for your medical billing business, and finding the right provider can make all the difference. It's day 10 of our series, From Medical Biller to Billing Business Owner, Balancing Work and Entrepreneurship, and we're halfway through our series. So after this one, we have 10 more videos to go. I'll be sharing with you some tips on how to figure out which type of provider is right for you and how to avoid the pitfalls that can drain both your time and energy. So we're going to jump right in and start with the provider's personality. Now, every provider's personality is unique and their communication style is different. So don't think that even if you got a good provider or this perfect provider that you have, that the next one is going to be exactly the same. So I've had providers who, one provider maybe was one that was always, in everything, asking questions, wanting to know what's going on, doing all the stuff. And they always wanted to speak to me directly on the phone. But then I have another provider who is very laid back, hands off, will speak to me in our provider meetings, but they don't really need to talk to me all the time. Email is fine with them. They don't have to call me on the phone, but they have different communication styles and different personalities. Sometimes there are dream clients that you say that you want. So you'll realize that maybe that hands-on client is one that you like because you like to communicate with your providers and you like them to, ask questions and just be involved. And maybe you feel like the provider who doesn't really speak or talk to you or get involved, you feel like you're not doing good enough for them and maybe they're unsatisfied, but you really don't know because they don't tell you anything. You just don't know. So you kind of, are on the edge with them. But you may like one style over the other. But when you're doing these consultations with the providers and you're talking to them, you have to try and feel out their personality and see if they fit with your unique medical billing business. You can also have a combination of providers. So maybe it's okay for you to have one provider, especially because you are working full-time. You might be able to have one provider who is really hands-on, like I said, who wants to talk to you all the time, who's always like in your face, asking you questions. Did you bill? Did you do this? Did you send out the claim? Maybe you might be able to have one provider like that. But then you have to say, well, my other providers can't be so clingy or can't be so wanting me all the time, because now you might not have the time to do that. Or you might decide that you don't want providers like that at all. But the only way to find that out is to actually do like a interview or do like a consultation with them and find out what their needs are. And in doing that, you can find out their personality styles and ask them questions that can help you decide whether or not they'll be good for your medical billing business. So determining what you prefer as far as a provider's personality will help your business greatly. Then there's the provider needs, and kind of went into that a little bit, but each provider needs something different. Some providers have complex billing, such as maybe a hospital or a facility that has, 15, 20 doctors compared to a solo practice. In one practice, you might have, simple claim submission and follow up. Then in the other one, you might have high intensity, high volume claim submission. So in both of them, you're providing the same services as far as claims, but one requires a lot more than the other one. So for example, if you maybe have a mental health provider, that provider may have a few lines or maybe one line or two lines, but it's not that much. But if you're dealing maybe with a surgeon or someone a cardiologist who does a lot of procedures, you probably might have one claim that has like 6 lines, and all of that requires for you to do more when it comes to submitting claims. So you have to try and figure out what the provider's needs are from what they won't need from you. then you need to understand their needs as far as within their office. Because you might talk to the provider, and yes, you can deal with the provider's needs, but then you have to find out about the staff. They're not working by themselves for the most part, and if either they don't have any staff, maybe they don't have a front desk staff, so now they're doing everything on their own, and when they hire you, they expect you to do everything like you were the front desk. You need to find out if that is what they're requiring or their needs are, because if you can't handle that, then you need to let them know up front. Either they have to get someone to do that, or they're not the right provider for your medical billing business. Ask yourself, do you have the expertise, the tools, and the capacity to deal with these providers? So depending on their needs, you will be able to answer that question. The key thing is to make sure that it aligns with your medical billing business and what you want to do and how you want to handle things. And then there is the provider's knowledge. Not all providers know about billing, and not all providers don't know about billing. When providers go to school, they don't, for the most part, learn about billing and coding. They learn about dealing with patients, clinical work, all of those things. So they're not thinking about billing and sending out claims and everything. So when they open their practice and now this is what they have to do, some of the providers say, I'm going to take on billing, and they start to learn what to do. So you might have a provider who actually understands what you're doing, who knows how to do it, but maybe just don't want to do it or don't have the time to do it. They will be a lot different to a provider who knows nothing about billing, because that provider may want you to start educating them and explaining to them certain things. But all of that you need to factor in when it comes to pricing, because if a provider is going to need you to explain to them more, educate them more, that's going to take more time out of your schedule. You can also think about when you need to train providers, how far are you going to go with educating them and training them? Is this something that's going to be a part of your services, or is this something that's going to be separate from your services and you can make some additional money off of that? Set boundaries when it comes to what you're going to teach the provider, what the provider is going to need to know. All of these are tasks and duties that's going to take up more time for you and kind of keep you back from even doing your billing. So you need to decide whether or not this is something that you can handle. Maybe you need more providers that are well seasoned into billing and know what it is, or maybe who have had a practice for a while so they know about, coding and denials and all of that. So you have to kind of think about those things when you're deciding to work with certain providers. So in my next video, I'm going to talk to you about how to speak to providers. We figured out what we need, what we want, and which providers we would prefer or which would be our ideal provider. But now we're going to need to know, how do we speak to them when it comes to first meeting them in that interview consultation part, then also when it comes to dealing with them and we're actually doing their billing for them. So I'll see you over there in the next one.